Toughening up warnings on some popular non-aspirin painkillers, saying that the drugs cause an increased risk of heart failure. The agency says it's making the change in light of some new data that just came out, and the affected brands are ones you know: Advil, Motrin, Aleve, for example. Let's bring in Dr. Marty Makary, physician and professor of public health at Johns Hopkins. So, Dr. Makary, we all know the names of those brands. What does this data really tell us?
Well, it's interesting. These are some of the most popular medications in the United States. I mean, maybe up to a quarter of everybody in the country are on one of these medications. And what the FDA here is saying is that we've known about the risks to the heart. They're very small. But we now have more information that those risks are definitely there. So they are upgrading the warning that goes on these medications to say it's not just that they may cause heart problems, is that they can cause heart problems, especially in patients that are high risk for heart problems.
Can you describe those heart problems? Because I think when we hear a story like this, we think, okay, so I'm going to take a few Advil and suddenly I'm going to have a heart attack. It's easy to go from point A to point B too quickly. So what kind of heart problems are we talking about here?
Well, these are problems like early onset heart attack and valve problems, problems with the heart function. But the real concern here is that patients that are at risk for these things happening anyway, people with a family history of heart attack or have had heart surgery in the past, it can precipitate these events sooner. And that's why the FDA is saying if you're at high risk, you're really the population that needs to say, hey, don't just take medications because we've thought they're safe. We liberally prescribe these medications telling people they're safe.
Right.
We should think twice when people don't really need them.
According to the New York Times, the studies estimated that the relative risk increased by 10 to 50%. Depending on the drugs and the dosages. So if you have any sort of heart problems in your family history, should you avoid these drugs completely? Why even take any of them?
Well, these are what we call lifestyle drugs. They're not preventing disease or treating disease. They're usually just allowing you to function better, usually. So if you can get by without them, get by without them if you're high risk for heart disease. You know, you see patients all the time that say, you know, doc, I'd rather just not take any medications. I don't like taking medications. There's probably some wisdom there when you don't need them.
It is, you know, you think about the reasons why, very simple reasons why you might take a painkiller, and now you hear other things about, for example, Tylenol. One wonders if there's any really safe painkillers out there, Dr. Makary.
Yeah, now Tylenol is separate from this, so it's considered an alternative to the drugs concerning in this report, but it's got its own risks of liver problems in high doses. So yeah, there's probably no totally benign, safe medication out there. Even aspirin is in this family, and that's what we use to treat heart attacks.
Well, it's a good thing. Just a reminder, if you don't really need it, don't take it. If you do take it, you have to be aware of this, and maybe just a nice warm cup of tea might help as well. Path of least resistance. Dr. Makary, great to have you on as always. Thank you very much.